Welcome back to The Change Physician. I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, and we are here to have a little host chat on these certain encounters we've had with patients that have really, changed our view or made a big impact on us, or maybe just completely converted how we were planning to practice medicine. Kevin and I have a few things to share that we thought you might be interested in. For those of you that are just chiming in and somehow came across us on YouTube, we are with The Change Physician, and we have a podcast community. You can check it out at thechangephysician.com. But I think Kevin should start and let us know maybe a lesson or maybe his perspective on why we're even bringing up this topic.
So why are we bringing up this topic? And I was a little distracted here. People see me and I kept looking at my shirt. And I'm like, what is that? There's a spot on me. It was moving.
It's a nice shadow.
It's the shadow from the microphone. Look at that. Right. I'm like, this is so crazy. But anyway, that has nothing to do with the topic. But, as we sort of journey through life, there's all these lessons that we learn. And I think one of the opportunities that we have as physicians, particularly in healthcare, and this may sometimes get overwhelmed with all the craziness and chaos and stresses associated with it, but there's a lot of learning. Mm-hmm. And being involved with people at some of the most intimate in the ways of things that they would normally not share. Really important periods of time when there is either crisis point or maybe they're coming through a crisis. There's a lot of depth there. And certainly from my perspective, there are encounters that I've had that have lasted with me for almost 2 decades now. And really have had a profound impact on how I view life, like not just in that moment, but remembering these encounters and how it has influenced me. Mm-hmm. So that, I think, is kind of the reasoning behind this. But
yeah, well, why don't you start with the one that's like most dominant in your memory right now?
That's the hard part. Is like once I started thinking one, they start snowballing because there's been so many.
Yeah.
And I'm going to pick out a couple from actually anesthesia. And one of them was, I think this was my 8th day in residency. And this wasn't so much about the patient so much, but what I learned as you can make something that is not a big situation into a big situation by becoming too hyper aware about what's going on. Mm-hmm. And what had occurred was I was new, I was inexperienced, obviously, 8th day in anesthesia with all the stresses that come from that. I'd love to hear we should do an episode on just the stresses of anesthesia. Because I think it was the most stressful period of my life. Like the first 6 months of anesthesia, we were without a doubt the most stressful time in my life. It was insane. But 8th day in, and I'm scheduled for a knee replacement, except this was a redo knee replacement, which is always fun. Someone who a little bit larger, so a larger BMI. And so you're thinking about that stuff. And we're going through the case, and the attending that I had was a pain attending, interestingly enough. So wasn't in the OR all the time. Why or why not that be relevant may make a little sense in a little bit. But so we're going through the case, and obviously it's taking longer because it's a redo, and redos always take longer than an initial. And we're going along, and I'm like, okay, well, why isn't our oxygen 99%, or why isn't it 100%? It was like 97%. And it was really bugging me. And I was doing those little pressure maneuvers that you can do, some valvular recruitment, where you kind of hyperinflate the lungs a little bit and let them extend, because when you have somebody who's on a ventilator, it doesn't act the same as your lungs normally do. Mm-hmm. And so there's, particularly out in the periphery, there's a little bit of little alveoli, little bubbles out there that oxygen exchange kind of collapse a little bit. So the oxygen level goes down. And this was super distressful to me. Like, I'm like, oh, this is so bad. They're, instead of 99, they're 97%, So I kept thinking about it, and I started talking to my attending about it and checking my attending about it. And long story short, me being so focused on a number that was pretty insignificant, but I was inexperienced, that sort of, I'm not going to go into details, but the day got really complex later on because of that initial sort of discussion. Because my attending wasn't always in the OR, maybe not, maybe I started putting these little seeds of doubt in his brain. And it just really quickly reminded me is sometimes you can make something that is really just is a okay situation. It's going to be, everything's fine, but I created a problem that didn't exist simply because I focused on a single number rather than the overall picture. So that was one. How about, did you have any sprung to your mind, or I got a lot more where that one
Oh
came
yeah.
from?
So interestingly, and I do think our next little recording should actually be about things that the stresses of anesthesia in training, or just in general, things people should know about anesthesia, and that we actually are there and don't just walk out after getting people asleep. At least they shouldn't be, not for any extended period of time. So I've had several things that have changed my perspective, and it's not just what I witness, or some things like you were talking about, where yes, your experience and ability to step back and see the big picture because you actually have perspective with some experience. Those things kind of help you delineate if there's anything to worry about. So, but there's also situations like with patients where they make you recognize the fragility of life and the amazing things about life. And I remember, I'm not going to name names or anything like that, but I remember multiple times I've had to withdraw care, and being in a situation where people are busy and everywhere and you're strapped, where you can't get someone that's above you to help you out with decisions or going through this process. No one's really guiding you on what to do, and you're just, learning as you go. And I the impact of life and death, and the magnitude and the weight that you carry to take someone through not just the patient, like literally you have families, you're trying to negotiate or navigate the situation of the emotions of a family and the dynamics going on. And then you're trying to withdraw care when you've never done it before. And of course you don't want to, make them nervous, but just even making that decision and helping them feel comfortable with that decision. Like those are things you don't get taught. Like you kind of have to learn that along the way. And I think I had to do that so many times. And my personality is one of, trying to accommodate to make it easier on people, especially in these circumstances. And I just remember, someone in their 40s, elective case, shouldn't have gone wrong. Something went wrong, and brain dead. And from, a surgical complication, not an anesthesia complication. And then trying and realizing, oh my gosh, when you leave the tube in and withdraw care versus like removing the tube and withdraw care, it's a totally different experience of what you have to endure and watch, especially when they're youthful. And so it was a painful experience to not actually suggest to pull the tube when you withdraw the care, because they go on and on and on for a while despite being brain, so these lessons that I learned were just from the whole medical care aspect. But there is the other side, and I'll just jump into the second and have you share another one. But taking care of a patient with complex regional pain syndrome, formerly known as RSD, all this stuff. And the particular, I'm not going to call out a service. There's a certain type of institution that was not going to provide her the care that I needed, that she really probably could have benefited from, because she was strung along for so many months without an adequate understanding of it. So it actually made things worse. So I was trying to help calm the nervous system down in a lot of ways, and some of the like just a basic little, you can do these little catheters and just kind of get things calmed down with some local anesthetic. And work them through some therapy, physical therapy. And I took it upon myself to help provide stuff and go to the home to check on them. And like, there wasn't enough resources to go around for this person with what they really needed and for me to feel like she was safe. So that's the extent of what I'm going to say. But that was that whole process, and the amount of gratitude from that patient, and to recognize that I'm trying to go above and beyond. And she was in a place of just extreme desperation, and obvious that no one was caring for her. Those moments, those are the moments you felt like you're really making a difference, because the system's not there for her. So I learned a lot about just people who genuinely are lost, and sometimes we have to be advocates for our patients. And so I think that one really stuck with me. And to the extent that even after I left my training and everything, I was still, she became kind of like a friend. She was no longer my patient, but it's not very often that I can say that, a patient became a friend. Those are very special circumstances where that, can happen. But I just cared deeply about her, and I wanted to make sure she was okay. And she, obviously did better, but it took a lot of TLC. And so I don't know. I think that changes you when you realize that some people do really need your help, and no one else is going to step up if they're following the rules. And I don't mean like illegal stuff, but if you only do what someone's going to pay, that doesn't mean that patients being served well. So anyway.
That's a whole episode right there on what are we doing and what are we serving or not.
Yes.
And that is it. I do think that's a tricky place to be, because if you give 150% to everybody, you can't, because there's just simply not enough time. There's not enough resources. There's not enough humanity. And so really where you direct that, but
that's a triage situation. This was an extreme situation.
It is a triage situation, but when you were talking about like withdrawing, it made me think of a couple different scenarios. Because I asked one of the ones, and one of the things I learned is I've never, ever, ever liked to be one who's definite. Like people want guarantees of certainty, and there's no such thing as guarantees of certainty, right? And I think that from a personal standpoint now, I also think is extraordinarily important for each one of us to develop that skill set of becoming comfortable with uncomfortableness, or becoming, the certainty that the only thing that we have is uncertainty is key. This comes out to health diagnosis. It comes out to treatment plans. It comes out to being comfortable for saying, I don't know exactly what quote unquote the cause is or why you feel so bad, but this is what I know it isn't. That to me is much more important now. But one of the things that you're never told to do is tell someone how well they're going to do. And I was on cardiac as an anesthesia resident, and younger guy for an elective valve replacement. And I had never, ever, until that day, people said, well, how am I going to do, doc? And you're the resident. You don't really feel quite like you're the doctor because you're the resident, but you're like, I think you're going to be okay. In this situation, he was a healthy dude. He had a wonderful family, everything else around here. And I go, I'm never going to say this, but you're going to do fine. Like, I never say this, but you're going to do fine. So 12 hours later, and again, a surgical complication for a number of different reasons. One, they were doing a new approach. They were using all this fancy equipment that people, just because it's new and fancy doesn't mean you want to get it done. There was a bad tear in the heart itself, something that I learned in the middle of the case tends to have 100% mortality associated with it. And that guy at around 2 a.m. Was not with us anymore. And where he passed is in somewhat of a debate, because people aren't supposed to die in the OR, right? So pushing sticks of epinephrine to get them so that they're in the ICU and things like that. But what and always stuck with me, because that was the one time I said, you're going to be fine.
Yeah.
And Yeah, it's just, you just don't. Yeah, it definitely sticks around with you. It's like,
Yeah.
and the willingness, because I've seen other people just spout this crap, and it's like, you don't understand how important these words are. And probably one of this comes back to, because one of my absolute core values is honesty.
Yes.
And so there was and there still is this deep betrayal, I think, to myself, because I said something that was fundamentally not true, because there's no way that I could have guaranteed that.
That's right.
But anyway, so that was you're talking about what, yeah. So I mean, we've had so many crazy things. Like, as for those who aren't in that sphere of anesthesia, it's such the environment is so profound. I mean, it is so intense. And we're in this weird bridge, like, as the surgeons, I think, in some ways don't necessarily understand it, because even their relationship isn't the same as ours is.
Yeah.
They almost come in and it's person on the table and they're doing whatever that they're doing, while we're sort of this bridge between life and death.
Yeah.
And yeah, anyway, pretty intense, like really, really intense. And that one for sure has stuck with me forever, is just the fact that there's no guarantees in life. There's no such thing as an easy elective procedure. There's no such thing of saying that we're going to do something and there's no harm associated with it. But man, yeah, I still think about that guy and his family, and that whole day was not a pleasant one.
So speaking of that, so one thing I think is, I say this pretty frequently, because I get asked about certainty at times, and I'm sure we'll talk about this in our other episode about anesthesia, but I have gotten to the point, and this is because of years of experience, and I actually have been doing anesthesia since my training started in 2005. So 16 years of doing anesthesia, which is like baffling when I think about how fast it's gone by. But there is, without a doubt, I say to people that I work with, my patients, I say, I never say never, and I never say always when it comes to the world of medicine. I said, there is always the possibility of either direction. And when it comes to, people wanting some kind of certainty, I'm of the mindset that honesty is one of my core values as well. I like transparency. It's the reason I do the stuff I do online, the things I've done in my past. Like, it's just part of who I am. And I think to be a good leader, you have to have integrity, and you have to lead with transparency as well. And so in this world of lack of transparency in the insurance world and the medicine many times, and people can be misleading, I think it's important. So when someone asks me, I let them know I've done elective cases. I've never lost anybody, knock on wood, in an elective case. Doesn't mean it can't. It doesn't mean it can't happen, but and I let them know, hey, if I'm doing trauma where I did my training, that's a totally different ballgame. The risk factors have exponentially risen. They probably die if you didn't try to help them anyway. But an elective, healthy kind of case, 99.9999999% of the time, you'll be fine. Maybe have some little hiccups, maybe an allergic reaction or some little, thing. But as far as fatality, I mean, in Austin, getting in your car, you probably have a higher risk of having a fatal car crash than, dying from, elective anesthetic with a healthy person, not someone sickly. But so anyway, that to me is important to say, that never say never, never say always in medicine. And that's my motto. But you did make me think of, there's two people, and just so like, when you're in this field and you're dealing with life and death, and I know for some surgeons that I was working with on these particular cases, same thing. They probably have this emblazoned in their mind. Another young man who had a routine elective case that ended up in the ICU for like a month and never made it through because of complications from the surgery. And I was part of the ICU team. Obviously, I was in general surgery internship, so I actually wasn't doing the anesthesia at the time. I was actually helping the general surgery. And then I had a teenager who was in a car crash that lot of like a multiple orthopedic injuries type thing. So you had like a 8 or 10 hour surgery for multiple repairs. And then you get an image that says there's a blush on the aorta and that they need to go take care of that. And I just remember being with an attending and kind of felt like kind of alone for the most part. And the moment that the surgeon started just cannulating, the aorta just blew. It just busted open. And it was like a partial bypass kind of setup. And you feel completely helpless. In that moment, kind of like you said with your situation, you don't see how you can come back from that. You're trying to do massive transfusions, but she's losing it faster than you can give it. And I just remember, and I'll never, till the day I die, I'll never forget. So the surgeon tried so hard, and I felt so badly for him. And, he had children of his own, and he went out there to face the family to say that she just expired in the OR. And I felt so badly about just everything, losing her, seeing the surgeon like destroyed, very caring surgeon. And he had to face the family. And I told myself, I can't let him be the only person that had to bear that burden. So I didn't have to, but I made myself go out there. I never met the family beforehand because the patient came in as a trauma, and I was the last person to talk to her. And so I went out and I talked to the family. It was mother and father, just, in shock and overwhelmed and just a mess. And I don't even remember if I gave them hugs or what. I mean, I'm sure I did. I don't know. But I just wanted to tell them I'm so sorry, and we tried to save her. And, but then that little part of your brain's kind of like, well, how bad was that blush? Because there's always that risk, the surgery is a trauma in and of itself, and with the inherent risk. And then there's, our anesthesia is like toxins. I mean, young, healthy person probably handle it fine, but, you just think you're always, like you said, there's no guarantee, and you always are putting somebody at risk, and you just always question yourself. Could I have done something different? Is there anything else we could have done? And that haunts you. And, but I think it was nothing. I didn't have an attending there telling me what to do or how to handle that situation. But I remember that to me, what was important is that he didn't go do that alone. Like I wasn't there with him, but to me, it was important that I saw myself as part of this, and that you still extend yourself in grief and in everything as a human being, like to still be a human being, kind of hold yourself together as much as you can. But I think showing humanity to a family and your genuine feeling of loss and pain that she didn't survive, I think it's critical and it's important. So anyway, that's probably the most intense situation emotionally I dealt with losing somebody so young. But yeah, that sticks with you forever.
So did you, did it change your perspective on anything?
I think sometimes you get so used to doing a lot of cases that people do fine, and you're kind of hopeful that, this, a good surgeon, like that everything should be fine, but we know that that's not always 100% the case. And so you don't always know how the body responds to what you do to it. And I think you gain a certain amount of respect and appreciation for the body, not in only its capacity to heal and capacity to be resilient, but also the capacity to not handle things as well as maybe you think they would. And just weird things can happen, go wrong, and your ability to recover from that is quite variable and can be uncertain and may not go well. Yeah. So I think you gain humility, despite the youth, despite a good surgeon, despite thinking you're, providing a good anesthetic. But once you have that much blood loss, it doesn't matter if the tank is empty. So yeah, that brings back a lot of uncomfortable feelings and just the devastation that family had to endure, especially after already going through almost 10 hours of surgery or 8 hours of surgery without a problem. I've been with her all day, so that's all I can say about the case without revealing any specific details. But
yeah, well, there's just all popping up and more and more and more. And but I think this is a good place to leave on this episode.
Yeah.
Maybe we can return to another time, because I think that for physicians, it's good for us to be able to express this stuff. Because I do think we have situations that can be traumatic in many different ways that we feel we can't share. And like, you're doing it, we're preserving information. There's obviously lots of time in between. So, but I don't think we get a chance to really talk about this stuff, because it really does have a substantial impact on not you in the moment, not just the families in the moment, but certainly long term. And to get those discussions out, and on the good side and the bad side, I think will be important. So,
yeah.
I'm going to wind this up unless you have something else that you wanted to add.
Go for it.
Yeah, I'm just going to say, hey, thank you all for joining us today. This is the Change Physician podcast. We're doing some discussions about really patient encounters that had an impact on us. And as I think you learned, that there have been many, and these are pretty profound, and there are more we'll talk about in the future as well. If you're interested in learning more about the community, visit us at thechangephysician.com. You can find us on Mondays and Thursdays in all your favorite podcast venues. If you would like this episode, even though it had somewhat of a not positive tone, but certainly a deep, meaningful one, feel free to reach out on either YouTube or iTunes or any of the podcast networks and give us a review. We'd appreciate that, or contact us directly at thechangephysician.com. And until next time, stay well.
Take care.